Hi, it's Mark here. In today's video, I'll be discussing the second most common treatment prescribed for sleep apnea sufferers. It's a treatment that's as effective as CPAP, but is more comfortable to sleep with, is not as expensive, is simpler to use, and is something you can actually travel with. Seems too good to be true? Well, let's see. The treatment I'm talking about is a dental appliance. Dental appliances come in many shapes and sizes, but most resemble a mouthpiece that is placed in the mouth before going to sleep. There are two major types of dental appliances: a mandibular advancement device, or MAD, and a tongue retaining device, or TRD. So, how do they eliminate sleep apnea symptoms? Simple. The device repositions the jaw so the tongue and other parts of the mouth don't fall backward while you're asleep and block your upper airway. The mandibular advancement device, or MAD, works by slightly advancing the lower jaw. Because the tongue is linked to the jaw, the advancing action keeps the tongue away from your upper airway by several millimeters, preventing it from obstructing your airflow. On the other hand, the tongue retaining device, or TRD, works at the level of the tongue. It places the tongue in a forward position in the mouth to prevent it from receding backwards and blocking your airway. A TRD has a suction bulb which pulls the tip of the tongue forward toward the teeth and lips. I know what you're thinking. If it's as simple as that, why are doctors still prescribing CPAP as the main treatment for sleep apnea? Without a doubt, CPAP therapy is highly effective, and that's why doctors use it as the first line of treatment. But it's estimated that 70% of patients prescribed CPAP fail to continue using it because of many problems. Problems such as nasal congestion, feeling like you're suffocating, dry mouth, difficulty falling asleep, nosebleeds, sore throat, skin irritation, noise, sinus discomfort, and on and on. I'm sure I don't need to tell you anymore. Now you ask, do dental appliances really cure sleep apnea? Or eliminate the sleep apnea symptoms? In the last 10 years, there have been many studies conducted to test the efficiency of dental appliances for sleep apnea, and the results tell us the same thing. They work. For example, a study published in the journal Sleep and Breathing focused on patients with severe obstructive sleep apnea. The patients were provided with a custom oral appliance, or dental appliance, and were asked to use it for a year. They were evaluated both at the 3-month mark and at the end of the study. The results were as follows. Patients' apnea-hypopnea index reduced significantly from an average of 49.3 to 12.5 at 3 months, and to 13.1 at 1 year. And systolic blood pressure was also significantly reduced in patients who had hypertension. Another study published in the journal Test also reported a similar conclusion for mild and moderate sleep apnea sufferers. The conclusion of the study was that a mandibular advancement device reduces apneas and improves sleep quality in patients with obstructive sleep apnea, especially in those with mild and moderate disease. So we can see from these two studies that a dental appliance, or also called an oral appliance, is effective for both mild or moderate sleep apnea as well as severe obstructive sleep apnea. Now, as you can see, dental appliances have high success rates in curing sleep apnea. But is it right for you? Well, the American Academy of Sleep Medicine says dental appliance therapy is appropriate for treating snoring and obstructive sleep apnea, if you find CPAP therapy intolerable, and for patients who are not good candidates for treatments such as weight loss or positional therapy. But what about your CPAP? Can you get rid of that darn machine when you start using a dental appliance? Here's what one prominent sleep dentist says. Many of our patients discontinue using their CPAPs after receiving their oral appliances. In fact, we have had a number of patients who report better results with their sleep apnea oral appliances than with their CPAP machines. And that's from Dr. Bruce Cannell, DDS. Okay, so now I'll bet you're convinced that a dental appliance is a great way to eliminate your sleep apnea symptoms. What else do you need to know about dental appliances? Well, as with any other treatment, a dental appliance has known side effects. Some of the side effects are as follows: increased salivation, gum irritation, bite changes, oral pain and discomfort, and there are actually a number of other side effects that come with dental appliances too. So how do you deal with these side effects? Well, that's a topic that requires more time than I have in this video, but if you click on the button below this video, you'll be taken to a page that provides a lot more information. Please click the button below now. Imagine, no more bulky CPAP machine, no more mask, no more nights of feeling suffocated. If you haven't given dental appliance therapy a try, I strongly suggest you look into it, if you fit the criteria I mentioned earlier. Please click on the button below this video to learn more. Well, that's it for today's video. Thanks very much for watching, and I'll talk to you again soon.